Today, we are going to talk about some of the issues that are affecting a number of communities in Australia, particularly Western Australia. And in this particular instance, we are going to talk about the African communities in Australia, and particularly in Western Australia. So there are a few facts that we need to talk about. There are 400,000 people of African origin living in Australia, and this is about the census in 2020. So, and in most cases, it is a joy and gratitude that African migrants experience when they, upon their arrival in Australia. In many other cases, there is the sense of sadness and how people have been affected by wars and how these conflicts have, in many cases, have ripped their lives apart. In many cases, forcing them to abandon their homes, friends, and families. And obviously, the resulting trauma, grief, and loss that people are going to experience. Today, this afternoon, we are going we have Joy Tuakeu Tuazama, who is the leader of the African community in Western Australia. But first of all, I just want to, Joe, if you don't mind, just to introduce yourself to Insight, if you don't mind.
Thank you, Eagle. My name is Joe Tuakeu Tuazama. I am from Africa, and I've been here for the last 15 years. And I serve as the president of the WA African Communities, which falls under the organization called the Organization of African Communities in WA. And actually, we're going to be having an elections next Sunday. So we're going to be electing new group of leaders. Professionally, I work as a biomedical engineer with St. John of God Healthcare, and I'm a father and also a community leader. Thank you.
Okay. Where do you come from, Joe? Where do you come from?
I was born in Liberia, in West Africa.
Okay.
And I grew up in the Ivory Coast.
Okay. All right. So you were talking about the organization of the African communities. Tell me a little bit more about this organization and what is their role in within the African communities, and how the African groups and communities are integrating within this organization.
Well, thank you, Igor. The Organization of African Communities in WA, OACWA, stands as the umbrella organization for the WA African communities. Africa is a continent that has up to 54 countries. And
exactly right, yeah.
Each of these countries have got nationals here. Some countries have a lot of people here, and some of them have just a handful of people here. So in 2015, this organization was incorporated to serve as the African communities in the African community in WA. And our primary role was to advocate, represent, and also educate the greater Australian public about the positive side of Africa and Africans that don't get to be told many of the time. So we don't have individual memberships. Our membership covers those African groups that are incorporated in WA from each of the countries. I'll give you an example, like the Zambian community in WA, the Zimbabwean community in WA, the Tanzanian community in WA, the Kenyan community in WA. These organizations form our membership, and we work closely with them to address issues that are of African concern.
Okay.
That's what we do.
Okay. Yeah. So we know that we live in a multicultural society where each migrant group or refugee group is able to live within their own communities. And I was wondering whether the issues we are going to talk a little bit more about the mental health issues in a little while, but I just wanted to understand a little bit more where the issues for African communities here in Western Australia are any different or are similar to the issues that migrant African communities are going to experience in other states of Australia. Do you have any thoughts about that?
Look, I think Africa might be a continent, and we might come from different areas geographically in Africa, but it is certain that we have similar problems all over.
Yeah.
Whether it be in WA, be in the eastern states, the problems might vary little by countries of origins, but the problem is the same across Australia. And I am not a clinician, but from a community perspective, being someone who has been active in the community for the past 14 years, yes, there's a mental health issue here. I think moving from your country to another country comes with its own challenges. And when we come over here as Africans, we come in different ways, and we come with different levels of education. We come with different styles and types of education. So to fit in is a beginning of the struggle. Some of us would do it quicker, and some of us would take us time. And to get used to the way of living here, particularly when you come here as an adult, to change your way to fit in or to simulate yourself, those things are causing some issues as well. And as well as leaving your home, coming far away when all your childhood memories are there, families, friends, people who are dear to you, you got a lot of them being left back there. All those things result into mental health for us. And when you are a parent, you got your own, an African parent, you have your own way how you brought your children up or how you were brought up, and those fundamental values that were instilled in you by your parents, you want them to be transferred to your children. But when you also meet up with the challenges of this society where the way parenting is done here is quite different from where we come from, it turns to be a lot of challenges.
Exactly.
And because you are navigating how you can do the right thing and not break the law here, and you also navigating how you can do for your child to become that successful person that you want him or you want her to be as an African. So the combination of all these things cause problems. Also, people who come from very professional backgrounds that have been used to positions of authority and careers that have come over here, it could be their education not recognized. They might not be people who did English in their country. They might come from Francophone country, Portuguese-speaking countries, and they have to start their life all over again from being that person who was a leader to someone who is a starter, who is doing things that he wouldn't have done in his country. They all result into numerous issues. So there's issues.
Yeah, and I think that fits very, very, very much and very well with Berry's theory about the acculturative process of people. Berry did indicated that there are many ways how people are going to integrate and how they are going to adjust in the process of moving from one culture to another. I was also very, very interested in one research that was done in terms of particularly the African community. In Western Sydney, Victor counted and Professor Andre Rinsanjo did research in and it's very, very interesting that they identified that 34% of the community, of the African community, were very integrated within Australian culture. 20% described as traditional, what we were referring, for example, people who are already already adults when they decide to move to Australia, and they have their values and all their perspectives already established. 22% were quite well assimilated, and where the values of the Australian culture are going to be the main values, and 24% are going to be marginalized. So in this context, also they talk about that older people were more likely to remain loyal to their home culture and reject the dominant Australian values. So what I am leading now is to talk a little bit more about in your perception, what are the mental health issues that African people experience in Australia? I know that you mentioned some of them, but particularly in our Western Australia community, what are the main issues that you are going to observe as a leader of the African community?
Look, disappointment is one of the main causes of mental health here, because many of the time as Africans, we found ourselves in a country where almost every decision, every law, every policy that governs us are made by people who see things from different perspectives, who see things from different cultural backgrounds.
That's right.
And that balance is not there to really understand how will this policy, how will this law impact those people who are now Australians of African origin. So sometimes the disappointment, the frustration, very huge. And when these things happen, it results into mental health. I go back to parenting. It's one aspect where a lot of mothers and fathers are lamenting, because when the kids are observed to be involved into antisocial behavior, the African parents want to come down harsh on the child because that's how they were brought up. And the system here condemns their action.
Exactly.
And they become powerless. And when they become powerless, when they start seeing a child going in and out of the justice system, it's causing a lot of grief for parents, and it's causing a lot of mental health. The issue of people being rejected sometimes when they want to do an initiative or a job or an endeavor that they think they are competent, they meet the requirement. Being rejected for it is very common, and that's something that frustrates a lot of people. And it results into mental health, because someone who comes and have gone to school and studied, and when they are very confident that they can do it, and they cannot get there, those things result into mental health. One of the issues that result into mental health here is the lack of support for young families. A lot of young families here are going through a lot. The system is arranged in a way that it actually very hard for people like us to bring our relatives here to support us when we have this young family. we are Africans, we are communal people. We believe in family. And when we start having young children back home, our grandparents, our uncles and aunties play a very key role. And that helps to reduce that stress and burden from the family, particularly the mother,
Exactly right.
or the woman who is having these children, and also the man. But because we come from far away, we got all our parents, our relatives, and those very important people to us overseas. And every time we try to get them here, it is believed by the immigration that Africa, people are suffering. So when they come over here, they won't go back. So most of the immigration results for our community, for people who want their parents to come and stay time, their aunties and uncles, get rejected. Sometimes they be given, if they request a year visa, they will give them 3 months visa. So that's a problem.
Yeah.
That's a problem. And all those things are resulting into mental health.
Exactly right.
Drugs and alcohol is also another issue. When people are frustrated, they turn to those things, particularly the younger ones, the young men and women. They get to be exposed to those things from schools and other things. And because the parents are powerless, how the system is structured, how they can engage them, the parenting here is different. Exactly. So those young lads, sometimes they abuse the substances and they turn to get depression or other mental health. So mental health is very, as an African man, I had to believe that Africans don't suffer mental health before. But now I'm realizing that we do. The reason why we don't really notice that when we are back home, because the support system, the way we live together, we have a very good network back home, and we are caring for each other. We show concern to each other, and those things not here for us. Yeah.
And I think that that's a very, very important point that you have made, where Africans come to Australia in order to protect, in order to progress within their families. And when children are affected in many ways through that process, that is going to destroy, and that is going to have a huge, significant impact, not only the children, but in the whole in the whole family system, and also in the community. I guess that's one of the issues that I wanted to also talk to you about. Is discrimination an issue that is affecting African communities in Australia?
Look, discrimination is here, but we cannot assume that Australians are discriminatory, because there are a lot of good Australians, and there are few people as well who are very discriminatory. And it is a normal thing across the world. I think what happened is most of the law, the policies and other things has systemic component of discriminations. And it might not be intentional, it might not be malicious, but because it was written by people who didn't see Australia being what it is at this moment. And that's why it is important that these things are not just reviewed, that those strategic decision-making areas, it is inclusive, it's diverse, so that decisions are balanced. I can tell you in Western Australia, for example, there's no African who is elected to council. And we live in councils all across here. So when decisions have been made or policies have been drafted there, the people who sit in those rooms are the people who are making the policy. They don't, because you have to be there to understand the people. And we are now on the table. Now we got one person in parliament for the first time.
Oh, that's
So
great.
we are optimistic that we will get there, but there are other areas where the way things are done, particularly the minor, the process, the procedure within them, it may not be discriminatory to somebody who is from Europe or who was born here, but for us, there are a lot of culturally inappropriateness involved, and those things can result or can be seen as discrimination. But we cannot say Australians are discriminatory because there are a lot of good Australians here. And I believe the government is working hard to ensure that we all fit in and things are done free and fairly for everyone. It just needs to be strategic and realistic so that we don't just get to be consulted for consultation's sake.
That's exactly right.
When the documents or when the policies are made, they are reflective of our diversity and multiculturalism.
Exactly right. I think that's the beauty of living in a multicultural country, where diverse communities are going to be respected and valued. But I know through this interview you have gone through a very, very, very important points about African communities. What do you think that are some positive and good initiatives in order to improve the mental health of Africans in Australia? Because I think that there is given that, considering the many factors, for example, the incidence of trauma and losses that many African people have experienced prior to their moving to Australia, I think that will, in many cases, when there is issues within the main society, I think that there are issues about depression and anxiety and even psychosis that are going to be the impacts that are going to be experienced by African people. So, what, in your view, with the knowledge that you have, what could be good initiatives in order to improve the mental health of Africans in Australia?
Look, this has to be something that requires a holistic approach from both state, federal, and local government of the day, because, like I said earlier, we come here from different backgrounds. So somebody who came from a war-torn country might have experienced trauma and so many things. Exactly. And when they come over here, they need that support system, they need that rehabilitation. And other people who have come here as skilled migrants, as professionals, they might need different type of support. And what I have observed is that it is time that the government notice or understand that only Africans can tell their own stories. Only Africans can help each other to the next level. There's been so much money invested in it, the sector, but when you actually measure the outcome, is very limited, and it is because when you get somebody who is different to tell the story of a different person and teach them something, it's very hard. So, community organizations need to be empowered. There need to be substantial and sustainable resources for them. And so giving them that support from both states, federal, and local government to ensure that they can step in and help. Because when they are having those discussions with each other, they know how to approach this person from this country. I come here from a country that have gone through civil war. So when I'm dealing with somebody who has experienced that, I know what they have experienced. When I talk to someone who say I'm hungry, I know what is it to be hungry. It is not an imagination. But someone who has not felt hunger, when you tell them I'm hungry, they think maybe he didn't have lunch, he didn't have dinner. No, that's not what we're saying. We're saying this person have not had to eat for almost 5-6 days.
That's right.
So the way the services are organized, the way the services are provided, they are more of ticking boxes than actually getting to the root cause. That's why you see a lot of people who have even been here over 5 years are still in transition. They are still in transition. Even more than 10 years, they are still in transition because somebody who does not understand them, who does not know what they need, is doing something for them. And these are the fundamental things that they will need to digest, that they will need to embrace and understand to make this integration and the settlement process smoother for them. And I think the government needs to start to understand that there are now many Africans who have been here longer, who have the prerequisite knowledge, the expertise and experience. And when the resources are made available to them, the transitional period will be less and people will get on their feet to run very quick. So that would be one of my suggestions. Also, the positive side of things is it needs to be understood that there are a lot of professional Africans here. There are a lot of Africans here as well who are doing very well. In WA, just WA, there are over 50 Africans who are medical doctors, general practitioners. I'm not taking on specialists, and other people are not taking on clinicians like clinical nurses and other people. But general practitioners, there are over 50 people who are Africans here. And there are over 25 Africans GP surgeries here. There are as well many Africans who are in the professional areas. And these people have got a lot to offer.
Exactly right.
These people have got a lot to offer. So when the community has the resources, these people will come on board in their spare time and give back.
Yeah, and I think that that's also reflect what is happening with Africans and with many other migrants and refugees coming to Australia. Is that despite in many cases going through trauma and losses, war-torn countries, and all those different traumatic experiences that they have gone through, they come here and they quickly adjust and adjust to the Australian society. And I think that sometimes we tend to pathologize a lot about the experience of migrant communities and particularly African communities, while as you were saying a few minutes that there are many professionals, good professionals that are contributing so much to the community here in Western Australia. I think that's a testimony of the richness of the culture and the richness of going beyond the issues about trauma and the resilience that many African communities will go through. Joe, thank you very much for the time that you have provided to us. I think that I can see that you are a very compassionate, a very humble, and very a leader of the African community. I hope that you can be related because I think that you have such a huge experience in working with your community. Thank you very much for your time. I hope that we can catch up later in this channel.
You're welcome, Hugo. You take care, and thank you very much as well.
Thank you.